Indocin, also known as indomethacin, is a medication used to reduce pain, swelling, and joint stiffness caused by conditions such as arthritis, gout, bursitis, and tendonitis. By reducing these symptoms, it can help you to do more of your normal daily activities. It belongs to a group of medications called nonsteroidal anti-inflammatory drugs, NSAIDs. If you are treating a chronic condition like arthritis, it's important to talk to your doctor about non-drug treatments and possibly using other medications to manage your pain. It's important to follow your doctor's instructions regarding the dosage and timing of taking Indocin. Before starting to use indomethacin, make sure to read the medication guide provided by your pharmacist. Also, shake the bottle well before each dose and measure the dose carefully with a medication spoon or cup. You can take this medication either with food, right after meals, or with antacids to prevent stomach upset. The dosage of indomethacin depends on your medical condition and response to treatment. For children, the dosage is also based on weight. To reduce the risk of side effects, use this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take it more often than prescribed. It may take up to 4 weeks of regular use before you notice the full benefits, especially for conditions like arthritis. If you are taking this drug on an as-needed basis, remember to use it as soon as the first signs of pain occur for the best results. Don't wait until the pain has worsened, as the medication may not work as well. And, as always, it's important to inform your doctor if your condition worsens. Some common side effects of Indocin include upset stomach, heartburn, headache, drowsiness, or dizziness. If these effects persist or worsen, talk to your doctor or pharmacist. This medication may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes elevated. Be sure to contact your doctor immediately if you experience any serious side effects, such as changes in hearing, mental/mood changes, difficulty swallowing, symptoms of heart failure, signs of kidney problems, unexplained stiff neck, or symptoms of liver damage. While serious allergic reactions to Indocin are rare, seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. Remember, this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Be sure to follow your doctor's instructions and consult them with any concerns. Indocin, also known as indomethacin, is a nonsteroidal anti-inflammatory drug that may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk may be higher in older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid taking this medication right before or after heart bypass surgery. In addition, Indocin may rarely cause serious bleeding from the stomach or intestines, especially in older adults. If you experience severe abdominal pain, bloody or black stools, or vomit that looks like coffee grounds, seek medical help immediately. It's important to talk to your doctor or pharmacist about the risks and benefits of taking Indocin. And if you experience any serious side effects such as chest pain, sudden vision changes, or weakness on one side of the body, seek medical help right away. Before taking Indocin, make sure to inform your doctor or pharmacist if you have any allergies to it, aspirin, or other NSAIDs. Also, let them know about your medical history, especially if you have asthma, bleeding problems, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus issues. It's important to drink plenty of fluids as directed by your doctor to prevent dehydration, especially if you are older, have heart failure or kidney disease, or take certain medications. Be aware that Indocin may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's best to avoid driving or using machinery until you can do so safely. Daily use of alcohol and tobacco, especially when combined with Indocin, may increase the risk of stomach bleeding. Therefore, it's important to limit alcohol and stop smoking. Also, be sure to inform your doctor or dentist about all the products you use before having surgery. This medication may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Older adults may be at greater risk for certain side effects, and caution is advised when this drug is used by children. Women of childbearing age should talk with their doctor about the benefits and risks before using this medication. It is not recommended for use in pregnancy from 20 weeks until delivery, and if used between 20 and 30 weeks of pregnancy, the lowest effective dose for the shortest possible time should be used. This drug also passes into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. Drug interactions can affect how medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with Indocin, including aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics. Taking Indocin with other drugs that may cause bleeding can increase the risk of bleeding. Examples include antiplatelet drugs, blood thinners, and others. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that are similar to indomethacin and may increase the risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent a heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. Indocin may also interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much Indocin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. You can call 911 or your local poison control center for assistance. Symptoms of overdose may include severe stomach pain, vomit that looks like coffee grounds, extreme drowsiness, slow or shallow breathing, confusion, and seizures. When taking Indocin, it's important not to share this medication with others. Your doctor may also conduct lab and/or medical tests, such as blood pressure, complete blood count, or liver/kidney function tests while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Indocin, your doctor may recommend non-drug treatments for arthritis, such as weight loss if needed, or strengthening and conditioning exercises to improve flexibility, range of motion, and joint function. It's important to consult your doctor for specific instructions on these treatments. If you are taking Indocin on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. As always, it's best to consult with your doctor for specific instructions on how to manage missed doses. Make sure to store Indocin at room temperature, away from light and moisture. Do not freeze it and keep it out of the bathroom. Also, make sure to keep all medications out of the reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless you are instructed to do so. Instead, make sure to properly discard this product when it is expired or no longer needed. If you are unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.